If you have hypertension, it does not necessarily mean that you're going to get diabetes. And if you have diabetes, it doesn't necessarily going to mean you're going to get hypertension if the diabetes is treated and controlled. And by that we mean, with regard to hypertension, we first start off with exercise and diet control. And if you're able to decrease that blood pressure, like again, we want normal blood pressures under 120/80, and if we can control that with daily exercise, which 30 minutes a day of exercise, as well as the diet, then it does not necessarily lead to diabetes. People are getting headaches from hypertension because of the constriction of the blood vessel. Hypertension is constriction of the blood vessel. So the headaches come when the blood vessels to the brain are constricted. And that's one of the ways that we know that, that people's blood pressures are up, or one of the symptoms that a patient will have, and then we'll check the blood pressure and it'll be elevated. But the headache is caused by the constriction of the blood vessel to the brain, and thus the pain. And to relieve the headache, then that vessel needs to be dilated. The danger in people sharing high blood pressure medication or cutting their dose in half to provide for family members is dangerous. Number one, to the person that's doing that, because they're not getting their full dose of medication. And number two is not knowing exactly what the etiology or the cause of that hypertension is in the family member or friend that you're loaning the medication to. So it's never ever a good idea to share medication. What can happen to the person that's actually sharing their medication is that obviously they're not getting the full dose, and those doses are what we call titrated, so that they can actually open, the vessels, and we need to get full flow. So the physician that's treating that patient is going to think that they're taking their medication daily, and then make adjustments based on thinking that they're actually taking what they dispense to them, and that can be a danger, because that's obviously wasn't the case. And then the person that's receiving the medication, again, that wasn't diagnosed specifically for them, and that can be dangerous. So the words are synonymous. Hypertension is high blood pressure. In other words, the blood pressure within the blood vessel gets high and causes the constriction of that blood vessel, and then it takes more force from the heart to circulate the blood through that blood vessel, and that's what we call hypertension, meaning more tension in that blood vessel. And or if you take the number, then the blood pressure number is actually high. But they are synonymous. High blood pressure, and again, getting back to knowing your numbers, the number that we want is 120/80, and below is considered a normal blood pressure, and above 120/80 is going into hypertension or high blood pressure.